like anyone who wants to turn on the camera, you're welcome to. We love seeing who we're talking to. But basically today, what we're doing is we are sharing with all of you the survey results from a survey we've done in the summer of 2025, so 3 months ago, about a quarter ago, where we looked at what are the level of mental health literacy. If everyone can go on mute, where we can look at, what is the level of mental health literacy. We'll show you a couple of the indices that we looked at. And why are we doing this? Because we are going to launch a campaign on the 22nd of December. Actually, we now have the official date that will be on TV every at Daka Leshesh and Daka Leshmon. It's 1 minute before 6, 1 minute before 8. That will be on psychoeducation. And we wanted to understand the baseline of what people know, what don't they know about trauma, about well-being, so that we can then focus the campaign on the right messages, and also so that we can take another assessment in a year from now and see if we actually made a difference, because very few psychoeducation campaigns have been done at the national level. Most of the efforts are done, one-on-one or in person. So we're going to do 5 things today. First, just an introduction of what is psychoeducation and what we're doing. Second, the methodology of the survey. Third, we'll talk about the findings and then the implications, and then 5, the Q&A, if you have any questions. And with me today to answer your questions are Professor Eyal Fruchter, my co-founder and head of medical and scientific affairs for ICAR, and Keren Dvir, a researcher who is a statistician who's been working with us to analyze their survey results. So for anyone who has more technical questions, let's say, we're all here to answer. Okay, so let's get started. I will share my screen now. You guys can tell me if you see it well. You guys seeing it?
Yeah, great.
You see the full screen?
Yeah. Well, no, I see just the slide.
Yeah, perfect. So it's the full screen, right? Yeah. It's all right. Excellent. So first, what is psychoeducation and why? In very easy term, what we want to explain to people is what happens after trauma. What happens to your brain? What are the effects, and what are the ways to recover? What we see from a lot of research is that just when you empower people with the information to know that it's okay to be okay, that also even if they're having nightmares or have a hard time sleeping, their brain is not broken. It's actually doing its job, right? It's protecting them. That's what the brain knows to do. And it strengthens the resilience of people, reduces stigma, because they understand that this is a natural phenomenon. And it has to be done, positively with a focus on resilience. Today, unfortunately, in the media, a lot of you are hearing a nation in post-trauma, and we're hearing all these messages that are actually not really helpful for the public. It's good for headlines and clicks, but it's not what the public needs to hear. So what are the primary goals of a psychoeducation campaign after trauma? It's to explain to people, what's happening to us because of the traumatic event, normalize the responses, understanding the symptoms, celebrate resilience, where people that have been through a lot, and we know from history that, getting back up is possible and recovery is possible. Making healthy coping skills accessible to everybody so that they know so people know what they can do, or even how to help a friend who's having a hard time. Promote social connections and peer-to-peer, and encourage help-seeking behavior when people need it, right? We are not trying to tell everybody that everybody needs help, one-on-one treatment or anything like this, really not the goal. Why did we decide to do a psychoeducation campaign? There are many organizations, great organizations in Israel that are providing services to the population, that are doing psychoeducation with their patients. But when one organization is doing a campaign, usually it's like, you know, putting a glass of water in the ocean. It rarely creates a big wave. Here, our idea was to say, how can we pool the resources and bring more players in the mix so that, you know, we can have a campaign where we have multiple players in the government, multiple players from the large organizations. And how could we make a real wave by working together? And how can this wave actually create a shared language around trauma, around healing, so that, you know, the population then also shares that language and can talk to one another about it. So how did we do this survey? The purpose of the survey is to have a baseline so that we can design the campaign, and then we can measure over time what if we're having an impact, and also understand from the campaign what are some of the messages that are most important. The survey was done in August with 915 adults. We then weighted that based on national benchmarks for gender, age, sector, region, education. We wanted to make sure we had a representation of the population in Israel. Most of the data was collected online with all the caveats, and, you know, that this comes with. Most people on this call understand that there are limitations to what you could do with surveys. But there were also a couple of phone interviews, especially because we wanted to get more Haredi and Arab Israeli respondents, and some of them are more easily accessible via phone. So what did we ask? We looked at well-being and stress. So that's a self-reported measure of how do I think I'm doing and whether I'm experiencing stress or anxiety. Again, like I'm insisting on self-reporting, right? So it's perception. Did I look for help? With who did I look? Where did I look for help? Are there barriers to getting help? What are the things that could help me in asking for help? And then a few indices that were built based on models, pre-existing evidence-based surveys. And we took questions from different surveys. One, you know, the first thing is resilience, measuring personal and community resilience, mental health literacy, stigma, self and society. What does that mean? Some people ask is, you know, self-stigma means, do I think I'm weak when I ask for help? Society stigma is, would I hire someone if I know that they have a mental health issue? Willingness to seek help. And then self-help awareness. Do I know the tools that exist for me to feel better? And then obviously a lot of questions on demographics that, you know, what you can assume around gender, age, education, etc. So let's go through the findings. And how we're going to do it is I'm going to walk you through the surveys, and then, you know, Eyal will add commentary on the things that he's seeing in the field, and also past research on Israel. And by the way, if anyone has questions, you know, feel free to raise your hand and we'll try to answer, and we'll have time for Q&As in the end. So first, interestingly enough, and very much in line with Israeli society, 65% of people tell you that they're doing good or very good, right? Even though when you ask them if they're experiencing stress or anxiety, you know, 42% of the people who are telling you that they're good or very good recognize that they're feeling stressed and anxiety, but they've normalized this. It's okay, you could still feel good and very good, even though you're experiencing stress and anxiety. Those numbers are much bigger, obviously, in people who say that they're feeling, you know, so-so, or that they're not feeling good, or they're actually feeling bad. In those,
Gila, you're muted, just for me or for everybody?
No, I think everybody
Oh,
hears
now
me.
you're back. Okay.
Okay. So most people, you know, are feeling stressed, and even, you know, they say they're doing good, anyways. That's not too surprising. I think you guys also know that in the happiness ranking of countries around the world, Israel is always in the top 5, And I think because of the war, we lost 2 spots, but we stayed in the top 7, if I am not mistaken. Now, even though 59% of people reported stress and anxiety in the last month, when you ask people, if they've sought help in the last year, 21% says, yes, I've looked for help in the last year. So it's not rare, but it's much less common than feeling stress or anxiety. And if you actually look at previous research, we looked at a 2020 survey, which obviously was around Corona. 8% of the population had reported that they had sought mental health support. So that is, higher, not surprising.
What is even more interesting if you look at it, apart from the fun fact that Finland is always among the first in happiness and in suicide rate, so sometimes you're so happy that you commit suicide. What is interesting, what I find interesting in the survey is that there was an article done by Professor Avi Bleich and Professor Zehava Solomon that was published in JAMA, which is a very good paper, on 2003, where they asked about 900 people during the hard times of the suicide bombers in Israel, 1998 to 2003, were the high years of these attacks and buses exploded everywhere. And they asked the people there, they've done a survey, and they found that although most people were either directly or by family member or first related relative involved in one occasion at least, they found that about 76% had at least one post-traumatic symptom in these people, and 58% suffered from severe mood deterioration, even some of them even answered to the full diagnosis of depression, and 83% regularly checked on their relatives, how they are, and 80% said that they use social support. But still, nevertheless, 82% were very optimistic about their personal future. 66 were optimal about the country. 75% were sure that they would be able to function once they meet with a traumatic explosion. And only 5.3% felt that they needed professional help, and less than 20% called the professional help. So these are the results of the year 2003. So when we are talking now on 2020, on 8% that sought mental health, and today we're talking about 21, we are in a much more using mental health situation.
Yeah, there's improvement. And what you're also sharing shows that in general, Israelis are pretty optimistic as well. So we'll see that our survey also showed that. Surprisingly, though, those who did seek help, so you see the N here is only 191. Those are the people who have asked for help. Almost half are looking at private support, right? And only a quarter are looking at HMOs. And then, people could pick multiple reasons, but it's, to me, again, not surprising because other surveys show that, but still surprising that in a country where we have HMOs and we have universal healthcare, so many people are still relying on private therapy when they need help. And when you ask people why they're not asking for help if they feel they need it, so when you look at all respondents, 50 said they don't need it, that's fine. 23 say they could cope on their own. In those who experience stress and anxiety, the numbers are a little different. 1/3 say, yes, I experienced stress and anxiety, but I didn't seek help because I don't feel I need it. And 30 say I can cope on my own. But then look at the other structural reasons or perception reasons why people are not looking for help, right? Many just don't believe it would help, right? And that is part of literacy, believing that there are ways to be helped is very important. And I am so shocked about the too expensive or did not know where to go. This is not acceptable in a country with universal healthcare and with HMOs that should have a very clear pathway, right? People should not be deterred because of cost. And having so many people, 1 in 3 actually in total, I will show you somewhere else, that say they don't know where to go is really too high. When people are asked what would encourage help seeking in those who did not, again, we see once again that it will be lower cost or immediate availability and easier appointment scheduling. So all these things, point to convenience. And then a few perception, personal recommendation, more clarity on the process, etc. And only, 10-13% says nothing would convince me, which is pretty encouraging. Then we looked at personal resilience using 2 metrics that are recognized as ways to measure personal resilience. One is how safe do I feel when I'm at home? And the other one is that level of optimism. Do I think things can return to normal? And here again, we see a very optimistic bunch of Israelis that are feeling safe and that believe that in the end, everything will be okay. And it is, again, in the community resilience, we see things pretty positive as well. Although, look at this, the orange, how smaller it gets with the question. The first question, the first 3 questions are about what do I feel about my community and my neighbors, and am I proud of where I live? And you can see that here people are pretty positive. And when you go down the list, trust in the authorities or trust in the decision maker, which we could call institutional trust, that goes down, right? With the time, with the numbers go down pretty clearly. And so, we could say that community resilience in terms of, close neighbors and friends, is pretty good. And we can work more on the institutional trust. Eyal and I were discussing this again, like this is something pretty constant as well in the Israeli population. So now everything I shared up to now were patterns of, how people feel, who sought help, who didn't, why. But that was, behaviors. And now we wanted to understand, like, what would make them change their behavior? And what do they need to actually be able to ask for help? And so first, when you look at the mental health literacy, we were pretty, surprised positively, right, by the high knowledge or high conceptual knowledge of Israelis, right? Here you could see all the different dimensions. And again, that is a survey, that's evidence-based, that's used for mental health literacy around the world. And we look at, how many people respond that they agree with those statements. And, people, do they feel like they understand? Do they feel like they can identify problems? Do they believe in medication, in psychotherapy? Do they believe they know the difference between stress and mental illnesses? All of these are pretty high. And that we can call like theoretical understanding, right? They understand in theory what is mental health and how it works. But when you ask them about their confidence, about applying this knowledge, right? Or can you recognize the signs in others? Do you know where to turn for help? Do you believe that people with severe condition can recover? That becomes, more, lower. And so it looks like people have high conceptual knowledge, right, in theory, but less applied skills. And that's one of the things that we want to try to bring out in the campaign, right? Try to give them more practical solution and practical self-help tools, etc. Stigma. So while, you know, overall, it looks like 1 in 3 people still hold stigmatist view, meaning like they either have medium or high stigma. The numbers look pretty good, right? It looks like at least 2/3 and more when you look at the theoretical acceptance is saying, you know, it's fine. Therapy is not a weakness. Going to see a psychologist is not a weakness. And that is pretty high, 72% of people. But then when you look at self-stigma, you know, in theory, you know, people are going to psychologists is not a weakness, but in practice, you know, I would probably need to hide that from my friends, right? I feel the need. And then I feel for many, you know, 40%, like I feel like other people would value me less if I go. So in theory, it's not a weakness, but in practice, you know, people will probably value me less. And then when you look at the stereotypes, which are, for example, that people with the mental health are for sure violent, or that people with mental health cannot work. Again, we see that the stereotypes have definitely weakened, but some stereotypes and myths continue. I'm pretty, in general, I'm pretty optimistic about stigma. I think we're doing a lot of good work and that things are getting better. And one of the things, you know, we could talk more about is how actually literacy and awareness might be more important than stigma in a sense. When you look at readiness to seek help, that was another index we looked at. Again, you have the openness to ask for help. You know, yes, I would want help if I'm feeling distressed. And yes, I'm feeling comfortable to talk with someone about my own mental health. Then, you know, the number drops when we ask them, do you know where to go now? If you're open to it, then do you know where to go? And 1 in 3 does not know where to go. And again, like this navigation issue should be one that we really, really try to resolve. I mean, the US during the opioids crisis, one of the first solutions was to build the 966 phone number where everybody knows what number to call. I think we can learn a thing or two, even though the US is not, you know, our best model for everything. But here, like really, when you understand there's a crisis, you understand it needs to be at the federal level, I think it's very relevant to simplify access. And then when you ask people if they know how to help a friend in difficulty, again, here the confidence is not as high. And so we would want people to know more about what's available and how to help folks. And just for the story, because he was so amazing, I heard Sasha Truvanov this week, one of the hostages that came back from the Chevy, from Gaza, and after more than 500 days. And he was sharing that one of his big dreams is that everyone in the population would know psychological first aid, and that everyone in the population would know how to help a friend in need. So that is something we can all relate to.
This is also very important, maybe here to inform or to acknowledge the forum about the mental health assistance is right care idea.
You're breaking up, Eyal.
Society understand that you don't need to come and home. That's the best.
שומעים בכלל.
Yeah.
Possible now you hear me?
Eyal, you sound really broken.
I'll try to make it better. So
Yeah.
okay. I'm not.
All right. Now you're back. You're even moving. Okay, try again.
Okay. So anyways, what I try to say is that the idea behind stratified care that is so strong now is that we don't need everybody to come to the top psychologist or to the top psychiatrist or to the top social worker to get help. We know that you can use much lower educated people in PTSD prevention and treatment if they are educated on the right principles and they know whom to send further to a
That's right.
higher.
All right. Well, looks like Binyamina is already being hit by the storm, Eyal. We
81% of those who are taken care of.
Yeah. So I think what Eyal was trying to tell us about is more stratified care and the fact that, we can have people trained as behavioral health consultants, or like, what the Kupot are doing now are great examples of training people on psychoeducation, on listening skills, and many of them end up not needing to stay in the waiting list because they end up understand once you've normalized what they're going through, they actually are more comfortable saying, okay, I feel like I'm not, it's okay. I'm crying. Well, maybe that's a normal reaction to what's going on. So very briefly, a couple of correlations that we found interesting, again, with all the caveats around it, around, the sample size or or causation versus correlation. Please note all of this. But one of the things that we're noticing, and again, in line with many others, is that health literacy is really the master key. And it drives, that's what drives more people to ask for help. Also, this ability to identify support, that was a cross-cutting factor, where when people know where to go for help, it's more likely that they will, and that they will know about self-help as well. That personal resilience is one of the, personal optimism, and we know that a lot of people right now are working on programs around hope, has a very big impact on well-being. Stigma reduction alone is not sufficient, and that's why, I'm optimistic about the reduction in stigma, but also we see that sometimes it doesn't have that big of an effect on help seeking. It's much more about, do I know when I need to get help, and do I know where to get help? That is driving people to look for help. A well-being paradox where people who report lower level of stress and lower level of of emotional distress actually also have lower mental health literacy. So it might be because they're disengaged, but what it tells us is that, prevention should target everyone, not only those in distress. And then, what I was just mentioning around the fact that help seeking is not always linked to the level of suffering, but mostly about the understanding and what people recognize as the sign. And so, what does it mean to us and to everyone in the country, right? Is really, we need to work more on mental health literacy, making sure that in schools, in workplaces, in the media, we are sharing accurate information about how we're doing and how to get better, especially specific populations that have more stigma and lower mental health literacy, which we didn't spend so much time on today. But we also need to integrate the stigma reduction into the literacy effort, not so much as a standalone campaign, and then use the community and the trusted voices like, the rabbis or the imams or the educators to help normalize those messaging. Really simplifying the pathways. We talked about this so many times, and I think all of you understand and see it. I mean, you guys see it from your friends or others, that how hard it could be to navigate the field. Build on communities. There are strong communities in Israel, and we need to strengthen them, especially for the 80% that don't necessarily need treatment today, but just need to remain strong. And then look at those high-risk groups. For example, we saw in our survey that Arab Israelis and Haredim have a higher level of stigma. So how do you work on specific populations and make sure that we close, the equity gaps that are linked to culture? And so now I'm, going to stop to share just so that we can see one another and we have time for questions and discussions. And very curious to hear your reactions to those survey results, any surprises, and or confirmations. Very curious to hear from you all.
And again, thank you, Keren and Naama, for building the survey and running the survey and processing the survey, which was great. And it helped a lot, of course, in building the psychoeducation campaign, because the basic of what we learned from that is translated there. So,
Eleanor, looks like you have a
Eleanor.
question.
Yeah.
Hi, so thank you very much for this wonderful talk and this very, very important survey. And it looks like there's a very important project on the run, so that's very, very good. And thank you for that. I'm Eleanor. I'm an adult psychiatrist. I have actually two questions. The first one, did you do any comparison between certain subgroup populations, between the Arab population and the Jewish population? Because I assume there will be many differences and the statistics will change. And maybe more of a comment rather than a question. I think also a lot of mental health professionals are also struggling with finding the resources to where to send patients who are actually in need. And I think there's a big deficit in a common platform where we can share information about certain centers or certain therapists. And I think that's one of the main struggles. So it's not just the patients themselves that don't really know where to turn, but it's also the therapists. And that's something at least that I deal with on a daily basis. And it's really a challenge.
100%. It's and imagine you're struggling as a mental health professional. Like what we're seeing on the field is even sadder, because people really have no idea where to turn to. And as you could see from the survey result, not knowing is a real barrier, more than stigma, right? And it seems like from the survey results. And then to your question, yes, we did a lot of different cuts of the data. We didn't bring everything today, but we looked at different cuts by education, by ethno-religious groups, by gender, and by age, so that we could see if there's any big trends and differences. So the educational gaps were very pronounced. So people who had only a high school diploma, for example, were very much more at risk, or if you compare to the others. The people who self-identified as a traditionalist Jewish, Masorati, we would say in Hebrew, also seemed more vulnerable, especially when they around mental health literacy. And then the Haredim had actually surprisingly very high resilience and literacy levels, despite the very high stigma. Arab Israeli respondents had significantly lower scores on all domains, except on the help-seeking readiness, actually. But for example, they reported even 64% of stress versus 55% amongst Jews, which is in line with the latest research from Professor Yossi Levi-Beltz, where they're looking every quarter at how the population is doing in Israel, and they're seeing that the Arab Israeli population is struggling more than the Jewish population for different reasons, stigma, but also community, etc. And in terms of gender, no surprises there, right? Women are better in terms of mental health literacy, greater help-seeking readiness than men, but no difference mostly in resilience of self-help awareness, right? It's mostly on the readiness to seek help. And age group was interesting to me because when we talk about stigma, right, we think the younger generation is going to be less stigmatized than we are. And the survey results were the opposite. The survey results showed that the 18 to 24 group had the highest stigma and were the lowest awareness on self-help and coping skills, like coping tools. And the 25 to 34 group also reported the lowest emotional state and lowest resilience While when we looked at the older adults, the population that's 65 plus, who have seen quite a bit in their life already, they showed higher resilience and similar help-seeking patterns to all the other ages. So these are the subgroups that we looked at.
Just the last question, were the questionnaires also in Arabic or just in Hebrew?
Also in Arabic.
Okay.
Ziv, you have a question? Your hand is up.
Yes. Hi, everyone. Thank you for this really interesting presentation and initiative. For those who don't know me, I'm a researcher. I just started my new lab at University of Haifa, and actually the lab is focusing on resilience and recovery. We're going to run a 5-year study now about resilience and recovery in the Israeli population, starting from the population level and then going to the individual. I'm a neuroscientist at my background, and focused more on PTSD until now, and now I'm kind of trying to switch to the more positive side of trauma. Yeah, I have many interesting questions. I'll be happy also to talk to you afterwards. I already talked with Eyal as well. But maybe 2 small questions. First of all, I think in one of the first slides, you showed that there was about 50% of the people who say they are feeling good now that didn't experience stress or anxiety, which was kind of surprising. Who are those people who live in Israel and didn't experience stress or anxiety? So that's question number 1. I need them as control group for my study. And second of all, regarding the community resilience, I think it's very interesting what you showed. I wonder if there's a difference kind of between when people think about their community, whether they think about their neighborhood or like city, or more in the sense of how much they trust, in the national level, in Israel, in the government, in the military, if there's differences between kind of your close surroundings and the more national level institutions.
Yeah. So there were 5 questions on the community resilience. The first 3 were very much about friends, neighbors, and Keren, keep me honest here. And then the last 2 were very much more linked to institutional trust, meaning do I trust my local authority, and do I trust the leaders where I live? And so those are more, and that's where we saw a dip in the numbers, right? So people were proud, could count on their neighbors, and felt like surrounded, but the institutional trust was a bit lower. And then to your question of where are the people that are doing really well, I don't remember, but we actually looked at that. I think we tried to look at Keren, do you remember maybe of who were those people who were feeling better than others? At bemute, Keren.
Especially the Haredim and some of the Arabs. And then there was you have to understand the question about stress was last month. It wasn't all the year round. So some of the people, I'm sure, just looked about the last month of their life and said, okay, it was a good month. But mostly the Haredim has a lot of weight, although we try to minimize it by raking the sample. They are there. Haredim and traditional Jews.
Yeah. So optimism and faith, I guess, helps with all of this. We could maybe say, but we have heard from other researchers, Eve, that when they're trying to look for control, they can't find, because everybody now is very high stress. When you want to do research on stress right now, everybody seems to be acute stress. So we can empathize with what you're going through. Other questions? Great. I guess we've answered all the questions, and it was super clear.
And we do hope that you would look at the news a minute before the news, and then you can, just turn off the television because news consumption is not good for your health. But to see a minute before, from the 22nd of December, our campaign for the society, the psychoeducation campaign, and
And I
share.
want to end with also thanking
Actually,
our funders, from JUF Chicago, from Micah Philanthropy, and Greater Philadelphia. Tamar was here with us. Rabia, do you have a question?
that's right. It's actually not exactly a question. I wanted to thank you, Gila and Eyal, for such an insightful lecture. We're at NAFAS working on this matter for the Arab community.
Oh,
The Arabs, yeah, we're trying to onboard more Arabs into therapy. So trying to be the bridge between the Arab world and especially the Arab community here in Israel and the therapeutic world. And I wanted to, if we can, like, follow up and
Please.
have a conversation about it, because we collaborated with Dr. Farida Aburas on the barriers to mental health for like seeking help. And there, I actually got a little surprised here because I thought it's only an Arab problem. But as you are showing us, it's the whole community here, which is interesting. But did you, my question, did you find any affordability barrier? Because I think that was the most significant when it comes to Arabs. Because like when we were interviewing our first clients, they were like, "Oh yeah, I have no $100 to waste on a 45-minute talk." So it's literacy, but also affordability. They don't know the value of such a.
When we asked, but that shouldn't, when we ask people like why they didn't see help, 9% answered because it was, 5% answered too expensive, and 9% of those who experienced stress, right, also said that's why I'm not asking for help, which to me is, given I know how much philanthropic funding is going into NGOs, and I know how much, how much support is coming in, like that should not be something people are worried about. We really need to make sure people feel like if they want the help, they can get it. I would love to continue conversing with you. We're actually just finishing a piece of research we've done on the Arab-Israeli population, where we actually did some secret shopping to try to figure out where there were available therapists that could speak in Arabic. The answer is not in a lot of places.
That's right. That's one of the barriers, because for Arabs, it was hard for them to see or to find someone who understand their backgrounds, because like cultural relevance is so important here, right? But also speak their language and in affordable prices. So like these three main issues came up. So only 10% of the Arabs actually turns to support, according to the last research.
So we should talk. And by the way, just for the story, I thought it was fascinating when you mix stigma and culture adaptation, right? Ben Gurion actually invested a lot in bringing Arab-speaking therapists at the beginning of the war. And the Bedouin Israeli students told them, no way would I talk to someone who might know someone that I know, right?
Right.
So although it would probably make more sense for me to speak to someone who understands my culture and who understands my language, etc., I would rather speak to someone that doesn't know anything about my family and won't be able to, get back.
Yeah, that's an interesting paradox that we're seeing. Like they want someone, but they don't want someone who might know them, so that they seek someone far away. But also, like, it's not that easy to get someone far away. So this is the paradox. That's why, like, we're trying to build a companion at first, but then to connect them after we convince them a little and give them a taste of therapy, to connect them with actual therapists and actual service providers, we call them.
Excellent. So Nafas is the name of the Amuta, and AFA?
It's not Amuta, it's for profit, it's startup company.
Startup. Okay.
Right.
Would be
And it's
happy to
Nafas
hear
is
more.
breath, if you don't know.
It's what?
Nafas is breath in Arabic.
Yeah, sure.
Nishama.
Am I allowed to step in for this very interesting talk? So I'm
Yeah.
actually working on a project that is focusing on peer support. So with
that's
lived
even-
experience, particularly in the Arab population, because of the specific things that you just discussed. So if you're interested, I would love to follow up and chat and connect further on. So thank you.
Yeah, absolutely. That would be amazing.
Excellent. Well, put your contact information in the chat so that we can all follow up with one another. Eleanor, that's really great. Also, by the way, we've been speaking with a lot of startups that are looking to do pilots on peer-to-peer support, like Toko, Dubri, etc. So if we can help making those connections, we'll be really happy. Excellent. Thank you all for joining and for this rich conversation. Looking forward to hearing from you guys offline, online, and then continuing to work together to reduce stigma and increase mental health literacy in all segments of the population. All right.
Thank you.
Thank you very much.
Thank you so much.
Of course. Have a great evening.
Bye.
Bye, Gila. Thank you.
Bye-bye.